Hi everyone, welcome to today's Global Grand Rounds. My name is Aisha Siad and I will be your host for today. Before we start, I'd like to go over a few things. So this presentation will be recorded and uploaded to our YouTube channel. On Zoom, you may turn on the feature called closed captioning during presentation to allow for subtitles. Please also create a Figure 1 account if you'd like to gain CME credit. And if you have any questions, please let me know. I provided all relevant links in the chat. And now I'm going to hand it off to Dr. Pekia, who will be introducing our host.
Thank you, Aisha. So great to have you on board and leading us once again. Much appreciated. And welcome to our latest episode of Global Grand Rounds. And I am the Medical Director of Global Offsite Care and Global Grand Rounds, and have the honor of presenting today a speaker from one of our supported projects in Bukoba, Tanzania. And today we have Dr. Eunias Ntangeki, who will be speaking to us about the signs, symptoms, and management options for the treatment of pressure ulcers. A little bit about Dr. Ntangeki. He was born in a village without health facilities, requiring a 3-hour journey on foot or by bicycle to access to medical care. At the age of 13, after suffering from malaria himself and being carried to a health center, he was inspired to become a doctor upon seeing the professionalism of healthcare workers in their white coats. He then moved to a small town for secondary education and later earned a diploma in clinical medicine. After graduating, he worked with the Evangelical Lutheran Church in Tanzania for over 15 years as a clinical officer before returning to college to obtain an advanced diploma in clinical medicine and surgery in 2011. He has since been serving at the ELCT Bukoba Town Health Center with over 35 years of experience in various healthcare settings, including dispensaries, health centers, and hospitals. Dr. Ntangeki provides treatment in both communicable and non-communicable diseases, handling surgical and emergency cases, providing counseling. He's fluent in English and Swahili. He's also an active Rotarian, a football fan, and enjoys poultry keeping and gospel music. He is married, has 2 sons, and 1 daughter. Welcome, Dr. Ntangeki. Looking forward to your presentation. The floor is yours.
Thank you.
Okay.
As Pekia introduced me, my name I am Eunias Ntangeki, Assistant Medical Officer at ELCT Bukoba Town Health Center. Today I'm going to present to you about pressure ulcers or delicate ulcers. Other terms say that it is a bed sores. Introduction: pressure ulcers is a skin injury caused by prolonged pressure on the skin. They can develop on any part of the body that is under pressure for a long time. For example, the areas with bone prominence such as the ears, ankles, hips, tailbone, sacrum area, shoulder girdles, and the back of the neck. They can also occur due to medical devices or other devices such as telephones. The epidemiology of pressure ulcers show that prevalence rate ranges from 5 to 15% in hospitalized patients, particularly affecting the elderly population and most commonly in intensive care units and long-term care settings. The incidences varies widely depending on the clinical setting, with the higher rates observed with limited mobility, multiple medical condition, and poor nutritional statuses. Over 70% of pressure ulcers occur in individuals over 70 years old, and while prevention is crucial, pressure ulcers are often associated with prolonged immobility and inadequate nursing care. Here it is the images which show the site for pressure ulcers. Most of the elbows, inner knees, back of the head, especially near the ears, shoulders, elbows, hip, greater trochanter's, lower back and buttocks, and ears. The symptoms: pressure ulcers can range in severity from patches of discolored skin to open wounds. They usually develop gradually but can sometimes appear over a few hours. Most of these conditions are clinically diagnosed. The stages range from stage 1 up to stage 4. Stage 1, the ulcer involves epidermis. Stage 2, the ulcer involves the dermis. Stage 3, the ulcer involves the epidermis. And stage 4, ulcer involves bone or muscles. Here it is the skin. This is the skin of patient whom I received 2 weeks ago from the village. Was not changed by the relatives, so it was intended to present this case to you. Also, this is the same wounds which got from that child, which was involved from the muscle to the bone, so it was in stage 4. Risk factor for pressure ulcers include immobility and prolonged bed rest, poor nutrition, incontinences, decreased sensation, skin moisture, pressure on bone prominences. Treatment of pressure ulcers. The pressure ulcers, if left untreated, can get worse and eventually reach deeper layer of skin or muscle and bone. Anyone who may have a pressure ulcer should notify their caregiver or healthcare professional as soon as possible. The following are ways of treating pressure ulcers. 1, dressing. This protects the sore or ulcer with the bandage to keep it moist and prevent infection. We use saline or normal salt in water, and we remove dead tissues. Sometimes you are advised to apply creams or ointments or powder to help to heal the sore as soon. Changing position. We are advised to move around regularly to relieve pressure on the sore on the ulcer. You should ask your care team for repositioning schedule, or use cushions or materials to help relieve pressures on in between the legs or the arms. Adjust the height of your bed. Number 3, medicate to use non-steroidal analgesics drug like ibuprofen or naproxen, sodium to reduce pain. And you are not using the antibiotic, but you can use the antibiotic where if you see that the sore is infected. And then we are advised to have supplementary food for promote healing. Number 4, surgery. If the sore is severe or other treatment don't work, you may need surgery to remove damaged tissues and close the sores. Other treatment, maintain a diet. If the patient is fat, you should advise to lose weight. You advise them to get enough sleep and do gentle stretches or let exercise to improve circulation. Prop up the legs or area near the injured body part with pillow or foam cushion, area with risk, and can be powdered with the priming pack to help the moisture. There are also special dressing that can be applied to protect the area from the further damage. Prevention. 1, change position, shift body weight at least every 2 hours to relieve pressure on patient skin. Number 2, supportive equipment, use of pillow, padding, or special designated mattresses and cushion. Number 3, keep skin clean and dry. Wash skin with gentle cleansed and pat dry. Number 4, protect skin, uses moisture, bears cream to protect skin from urine in the stool. Another complications which you can get when we get this pressure ulcers. This ulcer can change to malignant. So malignant transformation, it is easier when you get this sore or you get ulcers. Autonomic dyspepsia, osteomyelitis, if not treated properly, pyrethrates, sepsis, ureteral stricture, amyloidosis, and the anemia. Thank you for your attention.
Thank you, Dr. Ntangeki, for that review and excellent presentation and discussion about an unfortunately common situation that many of us witness in office practice medicine clinics, hospitals, nursing homes, homebound patients, and of course, patients who are immobilized or have multiple risk factors for the development of pressure ulcers. We have some time for some questions, and for those of you in the audience, feel free to post in the chat or simply ask to speak and pose a question to our guest today. I will lead with a question about telemedicine, one of the core missions, the delivery of telemedicine, of global offsite care to remote areas and for patients who may find themselves in, we'll call them healthcare deserts, situations that don't necessarily lend themselves to all of the typical tools that in areas of such as the one I am located here in Los Angeles, California, at Western University of Health Sciences. Our clinics often will see and manage patients with pressure ulcers and have imaging, testing, a variety of options available to diagnose, manage, and continue treatment for this. In clinic situations, perhaps such as the one that you're involved in, what is a common obstruction, if you will, to delivering optimal care for pressure ulcers, and how might your experience with the use of telemedicine actually benefit patients who are unfortunately suffer from this condition?
Okay, thank you. We get some obstacles, most especially from the families, because most of the families are poor and they delay to bring patients to the hospitals. So this can delay patients to come to the hospital, and the others, like this one which I presented, came very late because this child has a problem of cerebral palsy, and their parents, they needed to work in their gardens and the farms, so they left that child at our home without any support. So from that, she gets that pressure ulcers. So the poverty can cause most of people to have these problems. And the other obstacles, it is the distance from place where there is a ACE facility to ACE facilities. Sometimes to make the patient to come late to the hospital because of unattended or poor attendance from the nanny technique of the hospitals. I don't know if I have answered you or not.
Thank you. Thank you for that response. And we all have much to learn from how you approach this problem in your country and your clinics, and also how we might be able to use some new tools that telemedicine lends itself to. I'll ask one other question while we ask our audience to go ahead and post any additional questions, concerns, comments, anything that you feel you might wish to share with us that we can all learn from each other. My next question is regarding artificial intelligence, AI, or sometimes called augmented intelligence, in the diagnosis of conditions like pressure ulcers. We know that there's some work on using that technology to describe the wounds, to share photos of the wounds with an AI that can then supply some knowledge, understanding, and some evidence-based conclusions and recommendations to individuals that may not necessarily have training or experience in managing pressure ulcers. Question to you, from your experience, has or will augmented intelligence been at your practice in this situation, specifically the diagnosis and treatment of pressure ulcers? Dr. Ntangeki, were you able to hear my question?
Can you repeat your question, please?
Yeah, I'll shorten it up. Here in the States and around the globe, we've all seen how artificial intelligence, or AI, can help assist the medical team in making diagnoses and understanding treatment options for many conditions. And so for the diagnosis and treatment of pressure ulcers, from your experience, has artificial intelligence, or AI, been utilized in your setting for the diagnosis and treatment of pressure ulcers? And an example would be a patient who's seen with perhaps even a Zoom session that, just like this one, being recorded and summarized, and then subsequently have a document and a description. Have I then make an additional diagnosis and or recommendation from that description, and perhaps entering some photographs of the pressure ulcer into an AI program. Have you had any experience with that, or discussion about how that might benefit diagnosis and treatment of this condition?
Thank you. Here in our area, this diagnostic intelligence, it is yet, because we are in the third world. Maybe because of using telemedicine, you can be benefited from this technology of this artificial intelligence for treatment. But we use this local one with the normal saline, bandages, and normal dressing. So with the, as I said, we can give you analgesics for treatment, and sometimes we give antibiotics if the wound is infected. But for others, we are not yet here.
Great, thank you. Appreciate that.
So we'll have a question that's in the chat from FMC Yanagwa, Nigeria. So it asks, can ozone therapy help in managing pressure ulcers?
As I've said, the artificial intelligence is yet here in our region, and I think in Tanzania. But also, mostly we get the diagnosis by seeing and taking history and examining the patient and staging the wound, the ulcer, and then you treat by this routine.
Thank you. And then, but this specifically asks about ozone therapy for pressure ulcers. This one's not AI, but it has to do with ozone therapy. If FMC Yanegwa wants to go more into depth in the question, you feel free to unmute yourself and ask the question.
Actually, for this, I'm not quite sure, because here the technology is somehow low compared to yours. I can't say about things which is not used here.
I see. Okay, thank you.
I think on that particular topic, I know that there's some literature and some experience with using ozonated water for cleansing and disinfecting wounds, and that perhaps as an option over the use of more expensive and very often unavailable treatments, ozonated water really can be created with some affordable technologies and some electrical power to generate the ozonator, but really as simple as connecting an ozonator to a water tap to create a disinfectant that can benefit the patients. Potentially may not necessarily have access to more expensive and high-tech type of treatment. Something to consider down the line, and maybe a good example of how to follow up to a presentation like this with a dialogue specific to your needs, so that Global Offsite Care, its team, volunteers, as well as those who attend these sessions, can potentially dialogue in that way. And just a pitch again for figure1.com as a place to do that, to post cases that friends of Global Offsite Care can interact with those who post cases, as well as tens of thousands of others globally who regularly utilize the Figure 1 environment for care collaboration to de-identify posted cases, respecting the privacy of our patients, and at the same time to leverage this wonderful technology for collaboration to benefit patients wherever they may be. So again, thank you for your input on that. Any other questions, comments, concerns? I'm sure there are many out there that have experience and could share tricks of the trade, if you will, of managing this difficult problem. I know in the U.S., pressure ulcers are one of the most expensive and resource-intensive conditions that we see in the treatment of our population. And even though we have very often access to leading treatments and the management of this condition, it still occupies a great amount of time and resources and revenue here in the U.S. to deal with the tsunami, if you will, the constant pressure on our system to manage this condition, everything from early diagnosis to site treatment, nursing homes, house calls, and a variety of settings that allow us to try to tame the beast of pressure ulcers in our patient population. Any other questions, concerns? Feel free to tap out something in the chat, raise your hand, simply pose your question or comment. We'll give you a little bit more time for that and hand you back the gift of the remaining morning before you get your day started, or your evening, depending on from where you're logging into this meeting. Okay.
Hello.
There we go. We have who's speaking?
Dr. Becker.
Is that Princess Doctor? Come on. Thank you so much for being here this morning.
How are you?
Welcome. I'm doing fine. And,
yes, I have to. Yes, I have to. I have to, because Dr. Eunias is one of my doctors, and I've just commissioned them. And I feel very proud of him for this presentation, especially considering the fact that their lingua franca is not English. So he's done wonderful. And some of the technologies that are being presented to him, AI and Zoom technologies and all that, right now in the area where they are operating, they are yet to come across the knowledge. And of course, in the practice of medicine, you first of all face the needs of the people within the environment. So I seriously want to commend him for that bold step of, presenting. Not barely a few months that I commissioned them, and he was bold. Hello.
Go ahead and continue.
Yeah. So I am highly impressed with him. I just want you to take note that the lingua franca over there is not English.
Right. Thank you for that. And I can't imagine on the language issue trying to, even if someone like myself spoke Swahili, but not as my Swahili is not very good, truth be told. So I understand and actually very much appreciate you pointing out the gift of Dr. Ntangeki sharing with us in English. Job well done. Thank you again for that.
Yeah, thank you.
Thank you.
Excuse me.
For the time.
Thank you, Dr. Eunice. Thank you, Dr. Eunice.
Thank you.
Okay, and it looks like we have a hand raised. Mary Graves.
Yes. I wondered if you could stay on just a few more minutes. Dr. Smith from Eleuthera is driving, and he's pulling over now just to tap in and say hi. We just want to make sure he knows how to connect with us on his phone, and he's missed the last few, but we'd really like for him to be on, even if it's just for a minute. Maybe you mind staying on, Dr. Pitcha?
Oh, absolutely. And while we await that, and by the way, Mary, you might want to introduce yourself and as a long-term time friend and supporter of global offsite care, as well as Dr. Smith's role and the project that you support there. And then as we continue to wait, I'll leave it up to Asia to close the formal meeting if we have no other questions or concerns, and then we can await Dr. Smith's arrival. If you can, tell us a little bit about what Dr. Smith's role is and the clinic that he
Yes, all right. Thank you. Hello, everybody. Nice to meet all of you. Some of you, nice to see you again. Hi, Princess. Hi,
Mary.
Nigeria. Hello. So I'll start with Dr. Smith. Dr. Smith has been using telemedicine in a very remote island for almost 5 years now. And he uses the butterfly. And he also has worked with Rotaract. And we're always trying to get Rotaract to work with telemedicine because they meet with Dr. Smith, they make sure he's on time, they plug in his laptop, all those technical details. In fact, here he comes right now. Dr. Smith, let's see, is your face on there? Yay, I was just telling him about you. There's Dr. Smith. Thank you. Dr. Smith, has it been 5 years now you've been doing telemedicine on the remote island of Eleuthera?
Yes, it's been 5 years since I started this program.
Yeah, I just told him about you. Maybe you could just say a word about how telemedicine is going now in Eleuthera.
Telemedicine has changed a bit. At first, you used to do it like every week, but now it's like once a month. But still, I'm listening in and still learn a lot from telemedicine.
All right. Another reason Dr. Smith's role is important is because the Rotaract Club of Eleuthera has a group of kids that every year go to the Rotary International Convention. And they work at the Global Offsite Care booth. And they help bring in new members from around the world. And this year, a group is going. Some of the officers are from Eleuthera, but Dr. Smith has always been our leader, the main person that keeps it going, that we refer to. And just having it work for 5 years is wonderful. So how many of you are going to the International Convention in Calgary this June? Anyone on here?
I would like to.
Yeah, okay. If you come by the booth, the Global Offsite Care booth, there will be several Eleuthera Rotaractors that are from the same area as Dr. Smith.
Okay.
And I've been involved mainly because I'm advisor to Rotaractors. And we started out with just Rotaract in California, where I'm from, and Eleuthera, where Dr. Smith is. We used to have 2 clubs that were sister clubs. But now we have 8 countries represented. So it's called Global Rotaract Alum. And their main project is telemedicine, helping bring telemedicine around the world. And the reason we need them, so Dr. Smith, would you say that Rotaractors have helped you every week and every month for the 5 years that you've been on telemedicine?
Yes, they have.
Whether it's a Kenwood or Jacinta.
Jessica.
Yeah, Jessica. Just today, Jacinta made sure that Dr. Smith knew that we were meeting today.
Yes, she did.
And Kenwood will be at the convention if you want to meet Kenwood. But Eleuthera has played a very important role because they are a remote area. And Dr. Smith's been using the butterfly. Actually, before I sign off, Dr. Smith, can you say one thing about the butterfly? Are you still using it?
Yeah, I'm still using it
from
time to time. It's not every day, but I do use it.
What do you mostly use it for?
Obstetrics.
All right.
Obstetrics or gallbladder exclusion.
All right. Thank you. Thank you, Dr. Checky, for letting us have a few minutes here.
Absolutely.
I appreciate it.
Thank you, Mary, and thank you, Dr. Smith, for all of what both of you do, to help the world be a little bit better place, and specifically to address, common problems that come before you. And I appreciate your input. on that. I'm going to also call on one of our guests or attendees this morning, Ganche Anga. And Ganche, I know I'm putting you on the spot a little bit, but I want to take the opportunity to introduce you and to thank you in this session for all you've done over the years as in many positions and a volunteer at Global Offsite Care, including site visits, at least one or more to Tanzania itself, I think now maybe a couple of years ago, and for all the good works that you've done for the people there. And so I wanted to give you the opportunity to with us what you might see on a presentation like this from your on-the-ground experience and how building telemedicine bridges might benefit folks that are suffering from things like pressure ulcers that we all learned so much about this morning.
Thank you, Dr. Pekia. Thank you. My name is Ganche, and like Dr. Pekia said, I've been a volunteer for Global Offsite Care for about 4 years now, and initiated projects with my team, with Princess and Tella, who are also on the phone call here today, and we initiated projects in Tanzania together, 2022 and 2020, and they're successful in their telemedicine communication, and we hope that we can continue opening more sites. Dr. Eunias was wonderful. It was great to meet you and visit your town of Bukoba Town, a beautiful city by the water. So we really appreciated the time that we had together with you.
Thank you.
Thank you, Dr. Eunias. We met his whole family, and it was very pleasant to be together. Telemedicine definitely does unite the country. Tanzania is very special in a way where the government has telemedicine set up for the larger district hospitals, so they all are connected together. And so Global Offsite Care gets to be able to help out the rural hospitals and the smaller hospitals that are not part of that larger connection, and then try to get them connected to those larger districts hospitals such as Bugando. But it might be more beneficial that we get a few other larger district hospitals involved so that we can help Bugando as well in the telecommunication, and then maybe network some more smaller hospitals to the larger connections. But it's in the hands of the doctors. Global Offsite Care does what we can to support, but really at the end of the day, it's the doctors on the ground that are taking telemedicine and benefiting the community at the end of the day. So we appreciate their efforts and continuing the beginnings of our goodwill. Thank you for them.
Thank you, Ganche. Always great to see you. And we do not yet have a Hall of Fame, Global Offsite Care, but I can tell you that if and when we do that in the future, that I certainly would be nominating you as one of our first entrants into that, as we recognize your good work and those in the room who've been involved for many years supporting the mission of global telemedicine for the underserved. And again, back to the co-founders, including Dr. James Good, who is a noted and esteemed expert in tele-intensive care and telehospitalist care, and had the vision with some of our other founders to develop a non-governmental organization dedicated to bringing this transformative technology to providers and patients around the world. Okay, unless we have any other questions, comments, seeing none at the moment, I think we'll go ahead and hand it back to Asia to close. And again, thank everyone for their attendance this morning and their input and comments. So, Asia.
Right, thank you. Thank you so much, Dr. Ntangeki, for your insightful presentation. This recording is going to be uploaded to our YouTube channel in a couple of days. And as a last reminder, please use the links provided in the chat box to create a Figure One account. If interested, please sign up to receive our monthly Global Grand Rounds invitation. Our next Global Grand Rounds is scheduled for April 9th. And as always, we appreciate your participation and continued interest in Global Grand Rounds. Have a great rest of your day, and we hope to see you again. Thank you.
Thank you, and enjoy your day. Now in Tanzania, it's the evening, so we have different hours. And thank you for selecting me to be a presenter in this meeting. Thank you.
Thank you, Dr. Eunice. Nice to see you, Princess. Nice to see you, Tella, and Dr. Pekia. Thank you.